trying to log in. Flick is typing, which I'll just wait for Flick and then. Okay, I'm going to keep one eye on what Flick is typing to me, but thank you everyone for joining us for week 3, so the lucky last of our medical interview masterclass. I was thinking on the way here how excited I was, and then I was thinking about how much of a dork I am, because I'm really excited because we're covering my favourite of the interview frameworks. So I reckon that's like a 10 out of 10 on the dorkiness scale. Thank you, Flick, for offering to Sonali if you need to call each other. I think Sonali can hear us but not talk. So Sonali, if you'd like, it looks like that offer's there from Flick. Thank you. So just to quickly reflect on what we talked about last session. Last session, we really mainly focused on behavioural questions. So those tell me about a time when questions. I suggested that you get about 6 to 8 really great examples ready. And then usually, depending on what they ask you, which could be one of 100 things, you can usually pull one of those 6 to 8 examples that you've got worked up really well into the STAR format. You can pull that in. For example, your teamwork example might be the same as your leadership example, which might be the same as like, tell me about a time you did a good job for a patient. It might be the same situation, a similar task, a similar action tweaked a little bit, and then the result similar, but perhaps pulling out those bits which really emphasize whatever the question was that they asked you. So pulling out the teamwork characteristics or pulling out the leadership characteristics from that same example. We also talked about those questions that are kind of knowledge questions, so where you can really decide on 2 or 3 key things and address that. An example of that was tell me about something that you've learned from COVID or a challenge from COVID, and it's talking about what the challenge was and then what your solution or the known solution or things that you could have explored were. Second thing, second solution. So try and always keep your things in order and try and only have 2 or 3 things. From my experience, people just try and cover way too much. Whereas if you have 2 or 3 key things that you cover really well, it's a much easier answer. Of course, we're always going to have a beginning and an end. So having that beautiful motherhood statement, which shows some familiarity, and then that in summary statement really to show them that you're ready for the next question, especially in a lot of these interviews, which I know are quite time poor. So if you can say in summary, then that sort of wraps up your answer, but also just flags to them that you're ready for the next question. It removes that awkwardness from the room. So Nali, I think your video might be working now. So do you just want to say hello so that I can make sure I can hear you? Can you talk? Oh. I can hear you, but really quiet. Like almost can't hear you.
Hello?
Yeah, that's better. Cool. Thank you.
Okay.
Yes. Well done. Problem solved. So I've got you all muted, but it's only just so it's not so fuzzy, as Jason pointed out. So I do expect lots of talking later. So they're really the 2 types of questions that we covered last week. We also watched that video of somebody answering a question, which was a situational question, and how would they respond to that. They didn't necessarily use SPIES, which is what we're going to go into tonight. And I'm sure you guys are going to do an even better job than that person who got on the training program last year. So we today are going to talk about SPIES, my favourite ever framework, and I'm going to show you how to use it really well. There's this secret phrase that I think is going to help you hugely in answering these questions, which can sometimes be pretty tricky. And then we're also just going to summarise the session for tonight and talk about what the key pearls were, which is always really great to cover in a group. And then I'm also going to introduce what's next, so the study plan that I know Mariko was able to get a couple of weeks ago. But, you know, if you've got 1 week until your interview or a couple of weeks, or this is going to be something down the track, this homework will hopefully give you a really good study plan to go to from here to put in practice the things that we've learned and also do a bit more research. It's some pointed information that you can follow up. Any questions or any issues, you can wave at me now. Nope, everyone's looking happy. So remember what are situational questions? So these are the types of questions. I feel like every second interview has something about a struggling junior. So the scenario they give you might be, you are the registrar. If they don't tell you what level you are, always I think it's safest to assume you are the level of the job that you are applying for. If you feel like that needs confirming, just say to them at the start of the question, can I confirm, am I the registrar? Or can I confirm I am the whatever you're thinking that you might be? That's really important because you will handle this situation or any situation differently depending on what level. The main difference will be at what point you escalate. So you really want to show that you're ready to handle this scenario at level, but you know where your scope of practice ends and you know when to escalate. If you're not sure of what level you're acting in, that's really hard to determine, and you certainly don't want to under or overshoot. So this question is that you are the registrar and you notice that one of the residents or perhaps other registrars, usually it's one level below the level that you're applying for, is really struggling with their workload. How would you handle this situation? The other questions are going to look really familiar to all of you because that was your homework from last week. So they're all situational questions. They're often ethical, but not always. So often they're about a staff member and that staff member's doing something wrong, but they're not always. So a good example of that is, hopefully I've got it on here. Yep, I think the fourth one down without a dot is that you are asked to set up a journal club or a resident teaching or an M&M meeting or any other educational event. How would you go about this? So just take note of that question because that is not an ethical question. Nobody is doing anything wrong here. You're being given the opportunity to look after an educational session, but you can still apply this same framework. So we're going to think about that after I go through the framework. I would say any time they give you a situation or a scenario to deal with, this is when you need to go to SPIES. And I know you've probably all heard of SPIES before, but I really want to break it down for you before I give hopefully lots of you the chance to have a go of it tonight. So we're going to start with a motherhood statement. Remember, the motherhood statement is, I guess, like speed dating. The idea is that you give them a pretty punchy one line, which tells them how you're going to answer the question. So it's punchy, but it's also just really clear as to you tell them what you're going to tell them. So let's say they do give you that scenario, which is that there's a struggling resident and you are the registrar. They seem to be struggling with their workload. A really good motherhood statement, I think, does two things. The first thing it does is it shows familiarity with the situation. That's not to say that you are familiar. It's just, are you or are you not familiar? So if you've got a struggling resident, I would assume all of you are familiar with a struggling workload, with a struggling colleague. So you would say, in my X years as a medical officer, or in my X years as a doctor, in my X years working in this specialty, I have come across this situation often. If the question is, the boss has arrived to work and is drunk. You might not want to say, in my 5 years as a doctor, I have seen this situation often. You should flip that and say, in my 5 years as a doctor, fortunately, I have never come across this situation. But the first part of the motherhood statement should really just show familiarity. The second part, I believe, should tell them that you're about to use a stepwise approach. So I'm going to put that motherhood together for you if the question was that there's a struggling resident on your team. So in my 5 years as a doctor, I have come across the situation where a resident has been struggling numerous times. When I come across situations like this in the workplace, I like to use a stepwise approach, and I'm now going to talk you through that. So what I've done is show familiarity and told them that I'm going to use a stepwise approach. What this means is that for most situational questions, your motherhood sounds really similar. So if I go back to, too far back, if I go back to the slide, the next example of a situational question was on talking with one of your patients. You begin to worry from her dialogue that she is a victim of domestic violence. How do you handle this? So a motherhood statement for that might be, in my 4 years as a doctor, I have come across situations where I'm worried that I'm worried about domestic violence. quite regularly or regularly enough. When I deal with challenging situations like this in the workplace, I like to follow a stepwise approach. What you then want to do is take a breath, and then you're going to move into your stepwise approach. So as I know you would have come across before with SPIES, SPIES is the acronym that you should use. S is to seek more information. Unfortunately, in an interview, a lot of people are really trying to get to the kill and answer the question. But in fact, the questions are normally quite vague. You often don't know exactly what's going on. So this is the step where you should try and seek more information. Say, I'd like to find out more information about what's going on here. And then I suggest that you give, say, 3 to 5 examples of what you would want to know. So I'm interested to find out, is this resident, is there something going on at home for this resident? It might be that they've had a new baby and are really tired. So what I've done there is also use some hypotheticals, and hypotheticals show that you are familiar with the scenario. I know when another colleague of mine had a baby a couple of months ago, they were really tired and did need some adjustments at the start. Another person I was talking to last week just talked about their dog. They just got a new puppy. So they could say, I know we've just got a new puppy at home and it is exhausting. So bringing in yourself a little bit helps too, but just outline the further information that you'd want to find out. It's really good here to show that you're open. You're not going to jump to any conclusions. You're open to what could be going on, and you know the types of information that you might need to find. Then you move to patient safety. So often, as I said before, these questions are not about patients. They're often about staff members. But we need to show that we have an understanding that if a resident is struggling or a boss is drunk, the reason that we really care about that is because this could impact the safety of our patients and the care provided to them. So you can think of a nice one-liner that you say, the reason I'm really concerned about this struggling resident is of course for their well-being, but also because the resident is a big part of our team, and I'm worried about this impact in the care that we're providing to the patient. Then I feel like you've ticked the patient safety box. You don't really have to think about the patients again, generally, if this is not about patients. So it's almost like on their scorecard, and you've seen those scorecards last week and the week before, there's always a line about patient safety. Then what happens is you've done a really good job of outlining what could be going on here. It could be that the resident has a new baby. It could be that they have mental health problems. It could be that the workload is too high. It could be that they have trouble prioritizing. There's all these huge range of things that could be going on. And you've actually done a beautiful job of outlining that you have no idea what's going on. It could be a huge range of things. That makes it pretty tough to then decide what you're going to do under initiative, because the next step is to start talking about how you would handle it. This is what makes SPIES a bit clunky or tricky to use, and I'm sure if you've thought about using SPIES before, you've come across that. So that's where I recommend that you draw a line, if needed, where you say a line like, so for the purposes of answering this question, I'm going to assume that this resident is really struggling because of the high workload. You can pick, this is like one of those books that we used to read where you pick your adventure. You can pick your adventure. It doesn't matter what you pick. You're not saying this is what's going on, but you're saying for the purposes of doing a really good job of answering that question, you're going to assume it's X or Y. If you're really clever, you could assume something that's going to play to your strengths. So a GP that I was talking to last week for a GP training program position, she was practicing this with me, and she said, for the purposes of answering this question, I'm going to assume that the resident has mental health problems going on. And I was thinking, goodness, that's a very tricky path to choose. Like that's the least likely page that I would flip to in the book. However, it turned out she used to be an occupational therapist that worked in mental health. She's had a really great amount of experience in mental health as a doctor. So in fact, by picking that path, I think I've lost you. Oh no, here we are. My screen just went blank. But by picking that path, it actually played to her strengths. So you can pick the path of least resistance. You can pick what you think's going on, or you can pick something that's a little bit abstract, not too crazy, but that's going to play to your strengths. But that line, I do believe, will help you a lot. For the purposes of answering this question, I'm going to assume this is going on. Then you can move down to initiative, what you would do. It's a little strange because you've probably already started doing things under seek more information. You've probably sat the intern down or the resident down and started asking some questions. And now you're going to do some more. Some people have trouble separating that. But I always think that the seek more information is exploratory and the initiative is like what you're actually going to do about it. So you outline what you might do if the resident's struggling, what you're going to do on a day-to-day basis. You might talk about some phrases that you're going to use with that resident. And you want to outline all the things that you can do at your level. Then you move to escalate. So escalating is, of course, knowing where your boundaries are, knowing your scope of practice, and showing them that you will definitely escalate this up. And we can escalate to the consultant, the supervisor of training, the director of the department. It keeps going up and up and up, doesn't it? But there's also people that you can escalate out to. And I'm going to take you guys off mute and ask you to yell out. Who else do you think? Oh, I think all. Users were unmuted. So who else can we escalate out to besides this normal channel of people who are above us? Yeah, Rose?
That we often talk about in general practice is APRA. When does APRA need to be notified, particularly if there's a drug and alcohol issue?
Brilliant. So APRA, why would we tell APRA? One is drug and alcohol. What else is there?
Patient safety.
Patient safety. There's four things. There's four notifiable. What I want you to all do is have a Google, look on your phone right now and tell me what those four notifiable, what is it? What am I looking at? There's four, I just lost one word. 4 reasons that you need to report to APRA.
Mandatory reporting requirements.
Mandatory reporting reasons? That's just one.
So impairment as well, any kind of impairment.
So first is impairment. Linda said sexual misconduct.
Intoxication, which we already said.
Intoxication. What about bullying?
Significant departure from accepted practice.
Significant departure from accepted practice. What about bullying? Is bullying?
No.
It's not listed there, hey, which is interesting.
Bullying's a tricky one. It's not cut and dry, and I think APRA would have a lot of difficulty with that.
I agree. So when it comes to bullying, it's really good to say that your college has a no tolerance policy for bullying. Of course it does, as does your workplace. It might become an APRA reportable offence. That's the word I was looking for, reportable offence, if it then constitutes significant deviation from professional standards. But what I think is really clever is that any time this should be, when you're thinking about escalation, Rose, I agree this is when you start to talk about it. But when you're talking about what should and shouldn't go to APRA, I think it's really clever to say there is 4 reportable offences that need to be reported to APRA, and this is one of them. Be really clear about what it is. So those sexual misconduct type scenarios, they want you to talk about APRA. It will be a big bold line on their score sheet, and if you don't talk about it, I think you'll lose significant marks. So be really clear about what they are. I'm glad that you all looked them up and know exactly where to go. Google reportable offences, APRA, and it'll come up. But it's really good to know exactly what they are. Who else, and I'm going to unmute you again, who else could you escalate out to? Like, who else can help?
The college GP.
GP, college.
EAP.
EAP, which is the Employee Assistance Scheme or Employee Assistance Program, which in fact in a lot of hospitals or health services allows the staff member to get access to 5 free counselling sessions.
Sorry, what was that one?
Employee Assistance Scheme or Employee Assistance Program. So you should just have a bit of a Google. I seem to not be able to hear when we are all unmuted. Oh, that's good feedback. Okay, from this screen, can you unmute yourselves? Okay, that's going to work better. So Employee Assistance Program, you should all Google this and be across this. It's an amazing thing to drop into an interview, and it usually is a program which allows the staff member to get confidential access to counselling and support about whatever is going on in their life. It's not only if it's work-related, it's anything that might impair their work. So that's a really good one. GP is another good one. I am a medical education officer in my day job, so we look after the training usually and wellbeing of junior doctors. This kind of thing could come to me. And I get paid to help sort this stuff out. You guys don't, and you're really busy doing other things. So it's really nice to be able to know who your referrals are. Anyone else want to say anything? Just unmute yourself if you want to jump in.
Could you point out like social groups and stuff like that as well, like within the area, like medical mums groups, or is some bushwalking?
Absolutely. Really good. Yep. In some of the colleges, I know Jason referred to colleges, there's like specific special interest groups for things like wellbeing. So if you know about that, imagine if you can say the ANSCA special interest group on blah, blah, blah. Amazing. Yeah.
I know most of the colleges have a wellbeing officer.
Yeah, there you go, wellbeing officer.
There's also,
maybe, yeah.
You go.
Okay. Maybe forums and also like committees, and maybe even committees and forums.
Yes, brilliant. Excellent. This is so you guys should write a bit of a list of what everyone said. I can summarize that in the email perhaps to you after tonight. But I think it's about knowing the reporting up is usually pretty easy. Generally, people cover that. The APRA is really good to know and know the ins and outs of just the 4 reportable offences. But I think what a lot of people don't do is think about who you can escalate out to. So it's almost like escalate and referral, but I just like to think escalate out and up. If it's a patient problem, you can escalate out to people like the pharmacist or the social worker, etc. So always thinking about who is at your fingertips who could help you, who might be better at you than doing this. Like have spent 6 years looking after junior doctor wellbeing issues, and I'm paid to do it. So you guys might do what you can, of course, and support the person, but then get me on board. After the escalate step, it's, yes, Rose.
I just wanted to add that there's the Doctor's Health Advisory Service, which arranges for any doctor or I think healthcare professional to get access to a GP or a psychiatrist completely confidentially, which is worth knowing and talking to people about.
Excellent. That's so good. Thank you so much, Rose.
So I was just wondering, can we say unions, like medical officer unions and stuff, or would that be a bit political?
Yeah, so you can, but I feel like it might be a little political or controversial perhaps, because sometimes I think the people on the panel may have had, there's the option that they might have had a funny experience with a union. So I reckon don't say it, even though it's probably suitable. I think you want to be really sure before you started saying that, just in case. We want to be as non-controversial as possible. But a good thought. So after that escalating up and escalating out, then you talk about supporting and following up. So I always think you're not just going to like wipe your hands clean, do a little bit on the day, escalate it and forget about it. You then start to think about what you can do to support this person. If it's a colleague, you're going to check in with them, whether it be tomorrow, next week, next month, whatever would be appropriate according to the situation. And then I always think there should be a D on the end of SPIES. So just to make the acronym a little bit more confusing, what do you think the D might stand for?
Document.
Yes, documenting, whether it's Riskman or if it's something that's like not actually reportable yet, you might want to you would want to talk about making a personal file note. So if there was like maybe a hint of sexual harassment, but it wasn't actually sexual harassment, or bullying, but it wasn't really bullying, it might be appropriate to still make a file note, because what happens if in another week or month this comes up again? It's really good to have those details recorded. You guys are good at making file notes. You do it all day for your patients, so you really should mention that you would document it for yourself, regardless of if it's about a patient or colleague. But maybe you should suggest that it would be a confidential file note. There's a fancy name for that, which is a contemporaneous report. But I think you say that. I can never hardly remember that, so I can't imagine you would.
Brooke, sorry, where would we make these file notes?
So a personal file note you would just make in your own records. You might talk about a book that you have at home, or that you put it on your computer.
Just a Word document on your own computer.
Exactly. If you escalated it to anyone, it might be smart to say something about, I'd make a file note and send that through to the supervisor I escalated it to. That's a really good way to make a file note, because then it's tracked, isn't it, via email. But if it isn't a situation where an email is appropriate, I would just talk about making a personal file note in a document that I keep at home that's password protected or something. Yeah. So now we get to the awkward part where you make that funny noise and you feel that funny thing in your throat. Oh, yes, Sonali? You should be able to unmute yourself. Oh, I've unmuted you. No, I can't hear you again. I can hear you, but really softly. I can hear you only, like I can't hear what you're saying. I can just hear the tiniest bit of noise. You can type to me if you'd like, but I would like to hear you later. Oh, that might be better. Oh, she's disappeared. Come back to me or type if you like. So, of course, without further ado, what I was saying is the funny feeling in our throat. So, of course, then we know from the last couple of weeks that we say in summary. So, in summary, when faced with challenging situations like this, I like to seek more information, really ensure my patients are safe, do what I can do to help in the situation, and then escalate accordingly before following up. You can just wrap it up like that. What you need to do is wrap it up quite tightly in one sentence without adding new content. So I want to hear it. Who wants to go first? I think we're back to everyone having had a go. So Rose, let's hear it. What I might do is get everyone else to mute themselves. And Rose, are you happy if I ask you any question, or do you want one in particular?
I did have a trouble with some of them, but maybe, you know what, that's good practice, just whatever.
So which one did you have trouble with? This is just...
I was thinking of them more in the context of the STAR outline, so that's why I was just a little bit...
No, confused. So STAR, I'm glad you brought that up. STAR is when you're giving an example. So always, if they say, tell me about a time when, you use STAR. If they say, here's a scenario, you have to use SPY. So I reckon you should just have a good go. Let's do the registrar and the resident.
Oh, yes.
One. So I'm going to reframe it a little bit for you and ask, and I'm going to leave that up because this is not about you guys doing a bad job or being tricked. Just go really slow and work through it, and we'll all think about some feedback.
Yep.
So the situation for you, Rose, is that you are the registrar and the resident on your team seems to be really struggling and is seeming to come to work at least half an hour late most days. How would you handle this situation?
Okay, so firstly, I'm going to outline to you how I would address this issue of a resident struggling in our team. And I like to do this in a stepwise format. So firstly, I'm going to gain some further information from the resident, from the panel. I'll firstly ask, is this a medical term, or is this a term where we're just in a clinic? Or if we're on the wards, I would probably also seek a little bit more information from the resident themselves as to their current home situation. Are there any family issues? Are there any other safety issues as well? We're also talking about possible drug and alcohol issues. The resident themselves could be a victim of domestic violence. Doctors aren't immune to that, so that's also something to consider. And when I'm talking to the resident, I'll be trying to, maybe not overtly, but gathering little bits of information. Now, this issue is quite important because it does affect a patient's safety, particularly if you're in a high acuity medical term and patient safety is right at the top. Regardless of, it may also be something as simple as affecting the patient's experience of clinical care, but regardless of that, that is another reason that we need to look at why the resident is struggling. So after I'm sitting down and talking to the resident, for the purposes of this question, I'm going to assume that the resident is struggling because they've just had a baby. So I'm going to have a little bit. So I'm going to sit down with the resident at a quiet time. It might be at the end of the day. It might be at the beginning of the day, whenever that is, and just encourage them to give me a little bit of an idea of what their daily routine is and what they're struggling, how much sleep they're getting, and how much support they're getting from their partner and family. I'll try and raise in a quite sensitive way that I've noticed that there are a little bit of struggling issues, but doing it in a non-judgmental fashion. And trying to brainstorm with the resident ways that I can support them. It may be something like reducing some of the bulk of work that the resident has to do. Maybe something simple as referring to some baby sleeping services, or even discussing it with the consultant. I would then check in with the resident on a daily basis to see how they're feeling about the load of the day, or how they went the day before, and trying to adjust things on a day-to-day basis to see if that is helping. If things don't improve, it certainly would be something that I would escalate up to the consultant sooner rather than later, but I would also involve the JMO manager if necessary, or the wellbeing officer. There often is a wellbeing officer in the hospitals, I think. I remember, and even other health advisory services. So in summary, I've spoken about how I would manage the situation of a resident struggling with their workload. There may be several reasons for that, including having a new baby and other situations at home. For the purposes of patient safety, we do need to take these situations quite clearly, and I would try and support the resident and escalate up the chain if necessary.
Great, thank you. What do we reckon? Let's all write a little comment in the comments box. Maybe something that Rose could even do better, just so that we're being really nitpicky for her. Because we generally all think each other are doing a really good job. That's our baseline, which is awesome. Thanks for typing in. How did you feel, Rose? Anything that you forgot or would have done while everyone else types for you?
There was a little bit of repetition in phrases, I think, and talking a bit too fast, and a lot of ums and stuff.
That's okay. Ums are okay. I mean, they're there, and they're there for a lot of people. A really good tip is to watch yourself. So record yourself on your phone. I know I said this last week, and watch yourself back. What you can do is start to think about your ums in everyday practice and try and reduce them that way. We use them to fill a space. So obviously the thing that we can try and do is fill that space with silence and be a little bit more comfortable with silence. However, what I always say to people is don't get worked up about it. If you start really concentrating on it, you're going to kind of put yourself off. Every time you hear yourself say you'll be more and more and more nervous. So yeah, it's sort of something that we need to be aware of. If we can work on it, great, but if not, just leave it. So I want to...
Oh, yes. Thanks, Sarah. I did forget the mental health and mood issues, which is very important.
So really great emphasising. We've had the first two comments were how you emphasise non-judgmental, and the words non-judgmental is an excellent phrase to put in there. Thank you for that feedback. Yeah, the sleep training was excellent. So you're bringing in some of your experience there. Even like maybe experience as a mum might, either a GP or a mum, I can imagine that might come from, or maybe in peds in earlier
definitely.
Yeah, so that was really excellent. Flick, from a safety point of view, handover is usually in the morning, so I think missing that would impact patient safety. That would have been a really great link to patient safety. But also talk about rostering option changes. I like that as an example of how you might fix it. If it's that the patient, if it's that this person has a new baby, would shifting their entire roster back half an hour help? Really good. When I was thinking about this question, if somebody was really struggling, ask if they are feeling depressed, so start to do it like a gentle depression screen perhaps. Maybe need to consider a risk assessment for mental health. Access to daycare starting early being the reason they can't get there on time, so offering to help look around at possible other daycares. And that may not necessarily fit in with a new baby scenario. So much great feedback. Thank you. There's lots of things there that I was thinking about as well. I think when you're asked a SPIES question, everyone, these are questions that are made up, not about you. And so you've got to follow this stepwise approach. A really hard thing to do, but one that you should try and master, is bringing yourself in. So every now and then saying, I'm comfortable having these types of conversations. When I've seen this in the past, it's been this. And I think one thing that you didn't do that I think you should do next time is really show familiarity in that motherhood sentence. So I think your motherhood was punchy and nice, but and it sounded good, but I think you just need to say, I have seen this multiple times before. So show familiarity straight up. What you then did under the seek more information step is you did talk about hypotheticals, and that made me believe or made me think you have seen this before because you were talking about things that it may be. But I think straight up front, always say, I've seen this lots of times before. your patient safety line was quite long, I thought.
Yeah.
The point of this question is not about the patient safety. That's like an abstract thing that you need to address, but I reckon it needs to be one short sentence. The reason that I'm especially concerned about this is because I'm concerned about the care about the patients that this staff member is giving, full stop. Just think of it like a scorecard that says relates to patients and you've ticked that. Anything else, like wasting time that you could be using answering the question. So just shorten that in. I also wrote down the words non-judgmental. So that was something that was really good in the interview. Now, I wondered what everyone thought about Rose's approach to, like, I think you said that you could, like, cover them or cover some of their jobs or, like, allow them to come in late. There was something along the lines of that, wasn't there?
Oh, yeah, shifting some of the burden. If it was appropriate.
So what do we think about that? We all think, put your hand up if you think Rose is really nice. And put your hand up if you think Rose might get sick of doing that after a couple of weeks. So I think the point is you've got to show this. It's really tricky because you want to show empathy and, you know, actual like tangible ways to support this person, which is great. But you also want to show that you appreciate, though, that this person is still getting paid. They still have a job to do. So we've got to make it work so that they can pull their weight as well. I think it's always, and I'm really picking you apart on this, Rose. I hope you know your baseline was bloody excellent. I think that we've established that. But I think that it's for everyone, it's really important to make sure that, because I always think of the person on the panel that'll be like, oh, well, I had 5 babies and I was covering 4,000 patients.
Yeah.
This generation doesn't, you know, that person. So I think it's about just making sure that you're like addressing that. You know, in the short term, these are some things that I could do, but we would really need to sort this out in the longer term. And then perhaps it could be back to Flick's suggestion, which might be, can the roster be changed to suit it? And then lastly, in summary, needs to be really pulled in, really nice and tight. Don't repeat any. I feel like you kind of went back into some of what those hypotheticals could be, so really pull that in. So I reckon I would have given you like a 9 out of 10 after all that feedback. So 9 out of 10, that's going to, you know, maybe an 8.5, that's going to really push you up. But how did you feel about that line for the purposes of answering this question? Did that help?
Do you mean sorry, what line are you talking about?
For the purposes of answering this question, I'm going to assume that the person's had a baby.
Oh, that's great. Yeah. That is
helpful.
It just directs an otherwise undirected scenario that you
otherwise you kind of got to cover everything, which makes it a little bit waffly and not actually like targeted. So yeah, I feel like everyone's going to really like that. Awesome. Okay, I'm going to ask somebody else. I just want to check that Olivia. I keep letting you come in, but it's almost like,
hello.
Are you okay? I keep letting you come in and out.
I seem to like lose the sound sometimes, so I like swap to a different device.
Oh, sorry, Olivia.
Yeah, that's all right.
I wonder. I don't know if it's. I wonder if it's your end, but I'll keep letting you in regardless.
It must be my end, but yes, it must be very annoying.
Baby, I thought teamwork approach of workload, helping resident do some jobs, no jobs that you are too senior. That is a good point though, Jason. Sorry, I'm just reading the last bit of that feedback about there's no jobs that, you know, you're too senior to do. You're happy to help and yeah, cool. Okay. Who's next? Before you know what the question is. Was that you, Flick?
Yeah.
Woman?
Got my support dog.
You know what, Flick? I'm going to do a pennies one for you. Your support dog. That's so cute. We have a therapy dog in the emergency department at work. Very cute. But it's like rigorous training to become a therapy dog. Serious business. So I might mute all and then I'm going to get you to unmute yourself, Flick. But I would like you to answer a question using SPIES about so you've got a patient a pediatric patient who's presented to you with, let's say, like a both bone forearm fracture or something. And I don't want you to talk about the orthopedic dealing of that. Don't worry too much. But the scenario is that you've got a six-year-old child who's come in with a fractured arm. However, on examining the child, you are worried that this might be abuse from the parents, some domestic abuse that's going on just due to some markings and bruises that seem to be certain, you know, ages old. You can actually insert the question that would make sense here. But there's bruising that would make you think that there might be some domestic violence going on with the child. How would you approach this situation?
Sure. So actually, I'll put this again, sorry. Currently in my role as a resident on the adolescent mental health team, unfortunately dealing with situations where we are concerned about non-accidental injury is a very common occurrence and something that we do have to be aware of as practitioners. In our paediatric college, we do have a duty of care to protect children and to escalate concerns as outlined in the policy of the RACP. So the first thing I want to do would be to seek more information. And the way that I do that would be to go through the notes to look for any other presentations where potentially there were concerns about non-accidental injury, and I do that on IMR. I'd also want to look at the time that the patient presented after the injury, as this can be another telling sign. And I'd also want to ensure that from a orthopedics bone management point of view, everything was taken care of and the patient was stable. The next thing you need to do is look at patient safety. So part of that is, of course, going to speak to the child and the mum. And while I'm speaking to them, I'll be assessing their airways to see if they're able to speak to me, their respiratory rate and how they're breathing, as well as their circulation by feeling for a pulse. And just doing a quick top-to-toe check to make sure that there's nothing else that's being missed. And I just do that from the end of the bed before moving on to a more formal assessment later on. I also want to make sure that the child does have their broken bones in an adequate cast that the orthopedic team is happy with. I then move on to showing some initiative by speaking to the caregiver that's brought the child in, asking them some general questions. So asking them about the child, asking them about the child's development. Something that can be quite telling is a parent that doesn't know what their child is interested in or doesn't really remember a lot of the details about the child, such as when they first learn to walk and things like that, that generally quite exciting experiences that the parents are quite happy to tell you about. I then want to just ask some open-ended questions like, that must have been a very stressful experience. How did everyone react at home when this happened? What did you do? And asking them about the mechanism of the injury to see if it fit in with the injury that had occurred. And I want to sort of also try and be non-judgmental and say to them, it's really can be quite stressful having children. How's everything been going at home? Do you have a good support team around you, and how do you look after yourself? And sometimes it's also important if during a review that you notice someone is anxious or agitated, just to name it and say, you seem quite anxious at the moment. Is everything going okay? Is there anything that I can do to help you feel safe here? And depending on their cultural background, it would also be important to involve either like an Indigenous liaison officer, potentially a translator, as well as a support person, which could be another family member. Once I had gathered all of this information and completed a full examination of the child, I would then go and escalate my concerns to a consultant and explain that I'm concerned that this could be a non-accidental injury. And the reasons for that is because this is a mechanism that fits in with a non-accidental injury, and it doesn't, it's something that we wouldn't expect to fit in with a presentation. I then asked if it was possible for a consultant and a social worker to come with me while we speak to the caregivers about this. And we do this in an open way. We'd say that children unfortunately do get injuries and they can break their bones. But one of the things that we do have to worry about is that they could have had a non-accidental injury. And we just want to confirm that no one's hurt your child. And for this reason, we'd like to do some further investigations to make sure that your child is safe and that there's no other injuries that have happened to them. And then we'd ask for the parents' consent to do this, and we'd run through the different tests that we would like to do. And this may include a series of x-rays to look for other hidden fractures. And then we also disclose to the parents that some injuries that we see, we do have to escalate to other services like child safety. And it's not because we don't think that you love your child or that you're caring for your child, but it's just a way that we make sure that we're all doing the right thing to keep children safe, and we're all on the same team here. And that's to help keep your family together and to make sure that no one is hurting your child. And then we'd support the parents in this position. by leaving the social worker with them to discuss this further and what this could mean for them, as well as really thanking them if they do permit us to do these investigations, and explain that, just reinforce that we really appreciate that they've made the right decision. And then following these investigations, we would let the family know the results, as well as any other further things that may need to be done, and just once again re-emphasising that we're all on the same team here and how we can help in the future moving forward, so that we don't break down, so that there's no breakdown of the therapeutic alliance.
Don't mind me. I'm just writing down the word therapeutic alliance. That's also a nice one, isn't it? All right, what do we think, everyone? Rose says mentioning cultural safety was excellent. I also wrote down cultural safety. Any other comments? Just chuck them straight into the comments, the chat box team. Any reflections from you, Flick, on your own performance? How did it feel? Oh, you're muted. I've unmuted you.
Sorry, I muted myself. I would also like to have mentioned that if the family did disclose to me any domestic violence, that I'd really validate their concerns and thank them for sharing that with me, which I should have mentioned. And just not focusing on the clinical stuff so much, which is such like a knee-jerk reaction because that's what I'm used to.
Yeah. So do you think you should have focused on the clinical stuff less?
Oh, a little. I feel like I sort of waffled on a bit too much with that.
Okay. What do others think about the clinical content? Too much or spot on? Spot on from Sarah. Mariko, what do you think?
I guess because I come from a psychiatry background, we don't talk about, checking airways and stuff as much. So for me, that stood out as maybe not being as relevant for an injury. But in general, the clinical stuff about pattern of injury and stuff, and that being a suggestive factor and the time to presentation and all of those types of things, excellent for clinical stuff. Yeah.
So perhaps, and I agree, so perhaps you could pull in that like airways stuff into like a really short sentence. Rather than go into any detail about it, just pull it into one sentence that shows that you've thought about that, but then leave it and continue on with only the clinical information about what's actually presented. Yeah. The other good tip is if you're not sure about going on a tangent somewhere, like I don't think that was a huge tangent, Flick, but just say there is a lot to potentially cover there and you're not sure if you should do that or not, you can always just say to the panel, would you like me to go into detail about that? And they'll just say yes or no. And then if they say no, you can come back to where you were, you can come back on track. I think we talked about that last time with my warfarin counselling example. So I'm a pharmacist and let's say there's 5 priorities for this patient, one of which happens to be warfarin counselling. I might say to a panel, my second priority is to counsel the patient on warfarin. Would you like me to talk about the main things I would cover? And they will say, no, don't tell us all about warfarin. That'll take 10 minutes. So it's okay to kind of check in with where you want to go. Obviously, you probably wouldn't go through the warfarin counselling points. Does somebody else have their hand up there? No, cool. Let's have a quick look at the chat and then I'll wrap it up with a couple of comments.
I actually did that in my interview.
You got that? Oh,
I actually did that in my interview, and I caught the they're deadpan, but I caught the smirk at the side of the mouth when I said, "Would you like me to explain that further?"
Yay!
That was a good thing to have said. So
good job. That's so good. Oh my God, I wish we'd recorded your interview and we could have just played it for tonight. That's so great, and it works. Like I'm sure I've said this, but we don't have to talk and communicate differently in an interview than we usually would. Like if you're telling a story to your friend and they're looking a bit like bored, you say, oh, like, sorry, should I, I'll tell you, like, I won't go into that. But, you kind of take those cues and you can check in with them. But yeah, in an interview, not so much. Just Jason and Linda have gone, so I'm just getting them back in. Okay, so showed really good knowledge of process and factors involved. I agree. And this question plays to your strengths because you've worked in this area before. So you want to show familiarity like you did in your motherhood statement and show off that you know how to deal with this. There's no point pretending, like explaining this to a layperson. These people on the panel are in this area. So you should show off your level of knowledge about how to handle this stuff. Rose, an outstanding answer, particularly the use of particular phrases you would use with the parents and rephrasing the situation of NAI, non-accidental injury.
Yep.
Yay! As someone who may be hurting their child rather than the parent as the perpetrator. Sarah, I think mentioning the clinical information shows you had experience with that previously, just what I said. Perfect. Olivia, I'm having some troubles again. I may leave and catch the recording. Olivia, I'm so sorry. I wonder if she's... something must be going on at that end. Jason kept pressing the wrong button. So I think your motherhood was lovely. I think you showed where, you related straight to RACP straight away in your motherhood. That was excellent. You didn't tell them that you were going to use a stepwise approach. I do think that's helpful in your motherhood statement with these SPIES questions. So even just saying, I'll now run through my stepwise approach, I'll now run through a few steps. I think it's hard what to put where under seek more information and initiative in this scenario. But I just wanted to point out, you probably did some more seeking of information under the initiative step. But I just wanted to point out that is fine. It's really hard to draw the line as to what's exploratory generally and what's now dealing with the situation. So it doesn't matter where you draw that line. As long as you say patient safety somewhere, it's handy to do it after the S because then it sticks in your mind. That's why using SPIES in the same order each time is helpful, but it doesn't matter. So I think you did a good job of that, but I just wanted to point out some of that information could have moved. It doesn't really matter where it is. We were talking about the phrase graded assertiveness last week. You did a beautiful job of explaining probing within graded assertiveness and you even did the particular phrases that you would use. You did a lot of phrasing tonight, Flick, which was really good. And I know that you were talking to me earlier about that. So I think it's one thing to say that you would investigate something with a patient, but it's another thing to say how. And what Flick did tonight was really well done by using those phrases, just showing a few short phrases which can make me feel like I'm in the room with her watching this go on rather than it just like a kind of more robotic tick list of how I might handle it. It makes it much more believable and real to the panel that you know how to do this. So I think those phrases were beautiful. You dropped in lots of good things, cultural safety, all of those, talking about potentially bringing in the Aboriginal and Torres Strait liaison officer and the interpreter, all of that was really good. That's it from me. Therapeutic Alliance on the end, which I just loved. I'd like to hear, I think one more at least, of these situations. Whose turn is it? Who haven't I heard? Sonali, is your microphone working? Can we hear from you or is it not working? No, I can't hear. Oh, hang on. Try now. I've unmuted you. Try now. Well, I can't hear you, unfortunately. I can hear something, but I can't. It's almost nothing, so I might have to go to Linda. Do you want to have a go?
Did you say me?
Yeah, have a go.
Oh, hi. Yeah, sure.
Okay. Let's do the one with the medical student where you not a medical student, where you're asked to present give a session in resident teaching. I think this is a really good question that comes up in a lot of interviews. So let's say the scenario is you're asked to set up a resident teaching session. So let's say it's part of the intern yearly program and you're asked to present something. How would you go about doing this?
Okay, sure. Am I still yep, SPIES. Perfect.
Yeah.
SPIES. Perfect.
And the reason you're still SPIES is because I've given you a scenario. So every scenario, I know this isn't an ethical one, so I really want everyone to hear how you can how you can use SPIES. Because it all still applies.
Okay, sure. Okay. So as a medical student and also as a doctor, I had the opportunity to organize teaching sessions for medical students. And I would like to talk through how, in regards to this particular question about organizing resident teaching, I'd like to talk through it in a stepwise approach regarding how I would organize it, the teaching session. So firstly, I'd like to seek more information about the actual teaching program, what is expected from me, what topic we're covering, and part of that would involve speaking to someone who actually asked me to organize this, and also people who have done this before. So I know the standards that's expected from me. And also speaking to my colleagues, also the residents whom I'm addressing this teaching to, would also give me an idea about the expectations from this teaching, so I can ensure that their expectations are met from this session. In regards to patient safety, as a medical professional, that's a number one priority. So I would like to incorporate patient safety and into my teaching, make sure the way I organize this doesn't compromise in the residents from carrying out their professional duties. So timing the program would in a way that ensures patient safety would be a priority for me. For the purposes of answering this question, I'm going to assume that I'm going to do this teaching series about rheumatology, or perhaps approaching rheumatological diseases for basic physician training, So with initiative, as I've mentioned before, I would like to set my groundwork by ensuring I know what I'm ensuring the expected the goals for this topic and what the residents would like to know from me, and also making sure I look at the college guidelines so that I know the teaching outcomes and the curriculum for this particular topic, which is rheumatological diseases. In regards to once I've set the program, I guess I would also like to discuss with my supervisors, which might include consultants and also the director of the physician training, so that I can ensure that my teaching series is up to the standards and it is very relevant to the current clinical practices. In regards to ensuring, and once I've set everything up, it's about ensuring that it all runs smoothly, and part of that involves setting up a team. So throughout this, the whole setting program and the planning, I'd like to make sure I have a good team to help me through this the whole teaching program, which can include admin staff, also my senior colleagues and my fellow colleagues. So in summary, in regards to setting a teaching session, first of all, I'd like to seek more information regarding the actual teaching session, which would be making sure it's in line with the college curriculum. And I would also like to involve my senior colleagues and also make sure everybody is happy with the actual the teaching program. And finally, once I've completed the program, I would like to ensure that I get adequate feedback regarding how it was run, and also feedback regarding how I can improve it in the future. Thank you.
Great.
Sorry.
Well done. So let's all type some feedback, but I would love to hear what did you think about using spies? Because I think probably you hadn't thought that spies might work there, but do you reckon it worked for you?
I actually struggled a bit the initiative and escalating. I was kind of winging it a bit.
So I think initiative is somewhere where you could have gone into more detail about, right, you've got all this information now, you're assuming it's on rheumatology, which I think was a really great move, to assume it was about something, and hopefully something that plays to your strengths. It certainly was well aligned to BPT. But then I feel like you could have gone for it a bit more about what you might cover. I mean, you're not going to talk about the entire session, but the main couple of points about rheumatology, I might put up like imaging. You would insert specific, like what's the best types of imaging that would look at rheumatology. You could talk about that. Just talk about the main things that you might cover or how you might go about it. Like I always think if you're running an education session, and this is for everyone, you should think about making sure it's case-based, that you've got like show things like x-rays, etc., that are really case-based, even pull them up on the screen from a real put them up on the screen from a real patient. So I reckon that's what you could have done with initiative. It was tricky because you probably haven't thought about using spies for a scenario like this, but your escalate step was appropriate. You got to get other people on board. Admin people who are better at this stuff than you with organising rooms and getting the audio working, getting somebody senior to look over your work or even sit in to moderate or validate what you're presenting as whatever level you're at, a registrar or whatever level you're assuming you're at. Glad you mentioned feedback. Could have maybe inserted in support. Yeah. So what else? Good feedback, Jason. What else could have talked about as far as like support and follow up? What else could you do if you like to support and follow up with the learners?
Can I say something?
Yeah, thanks, Sarah.
So I had a really good experience with one of the journal clubs in the ID department last year. And what they did, they made you send in all of your journal articles like a week beforehand. So everyone that was rostered on had to really prepare. And then the director of the unit was in charge of the journal club. He would send out an email with the journal articles a day or two before the actual journal club was scheduled to happen. So we were all supposed to read the articles. And then he'd send out, within that email with the new articles, he'd send out a summary of the previous week's journal articles and what we'd discussed. And it was really nice keeping that sort of summary each week, and it was building on, and it just it was a nice scheduled, structured way to do it. And then, I mean, they were way smarter than I am and will ever be. But then I got to say some really smart things about their summaries of the journal clubs. And that was just really, really cool. I'd never seen it done before from a journal club point of view.
Feedback from everyone and then passing that on. Yeah.
Yeah. Well, like what you do, Brooke, in your emails.
I was like, have you ever seen that done since then, Sarah? I would like some kudos for my summarizing. No, but it is
really great.
And what I think the pearl from what Sarah has just given feedback on to Linda is that talk about in a SPIES, even though this is not about you and you've been given a separate situation, if you can pull something specific from your own practice that works really well, reflect on it and talk about doing that in this session. That is bringing yourself into the story. That is how you answer SPIES, but you bring yourself in. Something that I've seen work really well before is in our own journal club within this department at this hospital that I work in. So that's the type of stuff that you bring in. Really well done. I want to go back because there was lots of really good things that you did, Linda, and I feel like that was a bit of a tough task, but really worthwhile everyone hearing you do it and you doing it because it's a pretty good interview question, I would say. Beautiful motherhood statement. You started really well. You linked... You talked about the places that you might find some information. So I think it is about from the boss or the person who asked you to do it, and then also people who've done it before. I also think, you guys remember back to when you were junior doctors like PGY1, and there's like a curriculum, there's a curriculum that all this education is meant to fall into. So start thinking about, trying to find out what's been presented so far, what might fill the gaps. You don't necessarily have to say the word curriculum, but if you do, I'm sure they'll smile at you and write it down, just like they smiled at Mariko in her interview last week. I think there's two ways to link to patient safety. One is certainly thinking about when the session could be and will that impact on them delivering patient care. But I think the other link, and the reason I love education, is because if you teach them something that they can apply to their patients, that has such a far-reaching effect, doesn't it? So thinking about education as like, you can treat a patient or you can tell 60 people how to better treat 60 patients, for example. So just think about those educational values, I guess, of teaching people to look after more people. I think I loved that you picked rheumatology. I think a lot of people wouldn't do that. They would just still say quite broad. And I think having that line about, and I know I just love this line so much, don't I? I'm such a dork. But I think having that line about, for the purposes of answering this question, I'm going to assume the teaching is about rheumatology. That worked so well for you. I think they all would have written that down and really liked that you did that. You referred to the college guidelines. I loved that. And then I think you could have gone into a little bit more detail about what types of things you might teach, and you covered a little bit of it, but, show off. I think Sarah even said in the feedback, it's an opportunity to show off. Following up, I always think with following up with education, can you give them a handout? Can you give them something else to watch, like a journal to read, a podcast to listen to following it, thinking about the ways that you like to learn, which I'm sure is not a didactic lecture. I'm sure it's other things. So, that was a tough one, and I think you did a good job. Does that help a little bit, Linda?
Oh, yeah, Thanks for the feedback. Yeah, definitely the patient safety was something I wasn't really sure about, but I liked how you sort of bring it in. Yeah, and definitely having a framework. Now it sort of makes sense. When I first did it, I was like, oh, how do I sort of bring it in? But it definitely makes more sense now. Yeah.
And you know what? This is exactly why I make people practice the frameworks. And I suggest that you guys find questions, and I'm going to give you a study plan after tonight, but find situational questions. You can literally Google, like if you're applying for dermatology, you can Google dermatology medical interviews, and you will find thousands and thousands and thousands of questions that could potentially be asked in your interview. And, you know, you guys kind of know what might have been asked last year. You've got those lists as well. I know I've been working with a couple of people from anesthetics, and they've literally got like too many questions to look at from the last 20 years because somebody has been doing a really good job of keeping lists. So look at those lists, just Google it. And there's also just general interview questions. A lot of the questions are quite general, aren't they? Like a struggling colleague, that could happen in any workplace. So I want you to start looking at those lists, and I've got some in the study document. But then I want you to practice at least 5 times with SPIES. And I don't mean just think about it. I mean practice in the mirror, practice on your phone, listen it back. I think if you do SPIES 5 times with 5 different questions, you will be a lot less clunky in your mind. Not that any of you sounded clunky, by the way. I thought you sounded quite natural, but imagine how much more natural you're going to feel if you've practiced it only 5 times. You could do that in an hour. You could do that in like 25 minutes, actually. So that is the challenge for you. Use STAR at least 5 times, use SPIES at least 5 times, and I've got questions for you to do that. But I feel like once you've used it a couple of times, you think, oh, yeah, that's how I can use P, and that's how I can pull that bit in. That's who I can escalate to. Because it's not rocket science, but practice. You can't just expect to know the theory and then do it. You have to practice. Any more comments before we move on to the next type of question?
So just thinking about past questions, one of the ones I've seen come up that I don't really have an approach to is like, tell us what your like experience of the training program is, or tell us how you would work within the training program, or something like, you know, along those lines. They're looking for you just to describe the role, or what do they actually want out of that?
I think there's two types of questions there, Flick. One is knowledge of the training program. So I think there's the types of questions that are like, what do you know about the training program? What does the training program look like? You know, what do you understand about it? So that's the first type of question. And I do think you need to know what the training program looks like. I think it's about knowing that it's 5 years or X number of years and it's made up of 4 phases is a good way to start. I suggest you start really broad. Let's go back to a motherhood statement. I have been working towards this getting onto this training program for X number of years, and I am really familiar with the training program. So I would like to describe the phases of the training program and then what's required within them. Something like that. You want to show off familiarity and then tell them how you're going to answer the question. And then I suggest you go really broad. So you want to talk about the 5 phases, the 3 phases, however you can easily break it up. Describe that they're over X number of years and how long they roughly are. And then you go into more detail about what's in each phase. But I don't mean like 1 or 2 full minutes of detail about each phase. It's too much. What you need to do is be really short. And I would suggest saying things like, all of the phases have work-based assessments, blah, 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 whatever all the phases have. The way that it builds is the first phase has this, the second phase has these additional things, the third phase has these additional things. So you're almost pointing out the building or the differences between the phases. And then that's where you can go into more detail. Did you want me to talk more specifically about the types of WBAs? And they'll probably say, no, you've covered it. So I think it's about going really broad and then starting to really show off that you know what's in them and then offering them more information. The second type of question that I think you described is like, what is your approach to teaching and what is your approach to training? How are you going to tackle training? Would that be right, Flick? Does anyone have any thoughts on this? Just let, Sarah, I see your hand, which is brilliant. I'm just letting Jason back in. Seems to be having some. So, Sarah, what do you reckon? Do you want to have a go at that?
Yeah, I mean, I can. I saw a past question that was a slight edge on that, saying work-life balance. What does work-life balance mean to you? How do you propose to fulfill work-life balance during your training. And that kind of, I suppose, brings in well-being, but also knowledge of the training program and how you propose to get through it, because they want to know that you're going to, like, they want to let people on that are going to probably get through training.
Yeah, so it's almost like you've sort of done that, but you've sort of done what I'm about to say, Sarah, but I think if they said something like that type of question, you need to say, well, I think to answer your question, I need to break that up into my knowledge of the training program, and secondly, how I'm planning to deal with that, or how I'm planning to approach that. So it's almost like that is like a two-part question, isn't it? And so, Jason?
Yeah, so there's another question that I know a previous candidate got asked, or was a practice question, and others that, you know, he had a coach that was practicing with him and told him to say it this way, and other senior registrars that were practicing with him said, no, you don't want to say that. I guess the question was, do you think a fellowship year after training is important, or something like that? And I think one of the interview coaches was saying, oh, you definitely want to say, yes, it is essential for training, blah, blah, blah. But then the senior registrars are like, no, you don't want to say that, because not everybody goes on and does a fellowship. Like, those are questions like, how do I know what the proper thing to say is? You know,
okay, so I want to cover both. I feel like we've got two questions on the table at the moment. I might answer that one first, Jason, because I feel like it's the easiest one to answer. And I would suggest you do not be controversial. I would suggest you agree with what the college thinks and talk about why that's important. Certainly you can talk about risks and benefits, like, you know, not risks and benefits, advantages and disadvantages, or advantages and challenges that it poses. But I think you should go with the status quo. Know what the college expects. If a fellowship is part of the training, if a provisional fellowship is part of the training, you should talk about what's good about it to start with, some challenges that it might pose, but what you'd be looking forward to. You can even show off that the provisional fellowship that I might be interested in is this. Like, bring it back to yourself. That's how I'd answer that.
Can you even sit on the fence though, saying like, okay, the fellowship's important, like, because of this, but then you have a lot of consultants that come out and just practice without a provisional fellow as well.
What's the college's view on it? It's not necessary then? Yeah,
it's not necessary.
Okay, so if it's not necessary, then I do think you can say there's advantages and disadvantages. Okay. I think sitting on the fence is not great. I can't find the words I'm looking for there, but I think you should try and talk about, at this stage, you feel like it would be of great benefit to you. However, you understand that not everyone feels that way, and you might feel differently by the time you get there. You could say something like that. Yeah. But I think you need to talk about how you feel now, but just don't be really strong. You don't want to strongly oppose anyone's opinion.
Okay.
You know, so it's certainly easier if fellowship is part of the training, which is in some specialties, I understand. But yeah. Now to go back to what is, so I think we've covered, like, you know, the way Sarah rephrased that question. So I think we've covered the sort of showing off your knowledge about the training program. I think you can do that in lots of detail if you feel like you've got a whole question if it's the whole point of the question, you've probably got 1.5 to 2 minutes. If it's only part of the question, like, you know, how are you going to handle all of this? You want to show that, you know, the training program, but you probably only want to spend 45 seconds on that and then go into how you're going to approach it. So often a question I have heard is, what is your approach to training, or how are you going to approach training? And I think it's about having 2 or 3 key ways that you approach training. So we're going back to last week, you know, when we had the 2 or 3 key things. So 2 or 3 ways to approach training. For example, one is that I'm really committed to my own professional development. And then you talk about your examples of how you're committed. Every week I sit in on this honorary dermatology night, or I do this dermatology thing. Sarah's laughing at me because I'm trying to remember back. But you know.
Yes, I definitely do that.
The first is I'm committed, and I can show that I'm committed by all of these things that you're already currently doing, and you're not even on the training program yet. The second is I have a good work-life balance to support that. You know, talk about the things that you like to do outside of work, which allows you to be really fresh for work. The third thing might be, I'm thinking like, I'm really organized. I'm always planning ahead. I'm thinking about what I can do. In fact, the things I've already done, which are going to give me credits when I get onto the training program, is this. I would plan to do one WBA at this pace. You know, give them some specific examples. And I can't think of all of those because you're all applying for different positions here. But you've got to, I think, pick 2 or 3 key things. I think one is like commitment. I've already shown that, and this is how. One is the work-life balance type thing. You might want to add another one. But pick specific ways that you're going to approach training. You can't just like hit them with a word cloud of, I'm going to be organised and do this, blah, blah, blah. You need to really separate it and signpost it. But I think it's a good question to be ready for these, especially these training program interviews that some of you are applying for. How are you going to approach this? Maybe you could bring personal aims. Oh, Sarah, maybe personal aims to a fellowship, like Max Vax for head and neck microsurgery. You have to do a 3-year fellowship. Yeah, so really. Mariko, that's beautiful. If there's been a recent change in the program, mention it so it shows you know your stuff. Just wondering if you can take the situation and twist it to make it a session that you set up instead of I would, more so I did. Okay, everyone have a breath because I'm going to go back to what Jason said, but I want everyone to keep up. I know you're all keeping up because you're clever people. So Jason's just revisiting spies and saying, if they give you a scenario, can you say, rather than I would do this, you can say, I did do this. And Jason, that is the best answer. So if somebody says, you've been tasked with, a good one is you have been tasked with reducing or improving efficiency in theatre time, or how would you improve efficiency in theatre time? This is kind of like anaesthetics surgery type question. You can then say, in fact, last year I did a quality improvement project on improved efficiency in theatre time. So to answer your question, I'm going to show how I did do this. Or I had a struggling doctor last week. I'm going to talk to you about what I did do with this struggling doctor. The best way about how you would do something is how you did do it. But I think that's about the phrasing. When I've had this before, I've done this. I'm comfortable having these conversations. This is something that I see often in my 4, 5, 6 years, 7 years of medicine. That's you can do halfway, or you can just go totally to how I did do it. But you've got to make sure the scenario you're describing is the same as the scenario they're giving you. You can't say, well, the way I would dealing with a struggling doctor is the way I did something completely different last week, and they'll be like, that's not what we asked you. But yeah, beautiful. Okay. This is really, I know we're kind of jumping a little bit, but before we move on, is there any other types of questions that people still are not sure about? Yeah, Linda?
One of my regis said when he did his interviews, he was asked about things like artificial intelligence and their role in medicine. Yeah, so how do you sort of approach questions like that?
That was the most beautiful segue. It's almost like I'd set you up for my next slide, which is the last type of question. And this is these like other questions or random questions. So I think it's all about, there is millions of random things that they could bring up to you. They could say, what is your spirit animal? If you had $1 million, where would you go on a holiday? What is the last journal article you read? Just this random stuff. Some of it is expected. So some of the questions I've got on the screen are like, what is your understanding of cultural competency? How do you make clinical handover safe? They're like random, but somewhat related. The way that you try and work out those types of questions is you go to the college website or you go to the job description and you have a look at what are the hot topics. You have a look at all of the documents, the position statements that they've got, and that kind of thing will be in there. You don't need to rote learn them. You don't have time for that. But just knowing roughly something about each of those areas will be good. The way that you answer these questions about artificial intelligence or what your spirit animal is, what do you think they're actually trying to test? What are they trying to get out of you when they're asking you questions about artificial intelligence, spirit animals, holidays with $1 million? What do you think they're trying to find out? Everyone write it in the chat box. Values? What else do we think? I'm waiting for a few more answers. Rose, well done. Future. Yeah. Mariko, ability to think on your feet, wouldn't have been able to prep for the question. There's no way I could put them all up, even in 100 slides. Yeah, I like that too, Sarah. I'm going to use that too. The next time I do this course, this is going to say cognitive flexibility questions. Yeah, so I really believe they're absolutely trying to throw you something that you haven't prepared for. They're really trying to test your ability to think quickly and communicate well. So I think it's about having a pause. What you come up with isn't important, and a lot of people will freeze in these types of questions, but it's not about, there's no right answer. You know, I think it's just about actually kind of having a laugh or saying something like, I haven't thought about this one. And then just talking around it a little bit, you know, thinking about something that you can bring in from your own experience or a thought that you've had about it. If you have no idea, you need to communicate that, but I'm sure we're all intelligent enough to come up with something. It is really tricky. So maybe let's have a go at one. Who's up for it? Jason, you're up for it, I reckon. Rose, I want you to ask Jason any question you like to show his cognitive flexibility. Are we all ready? I'm going to unmute you all. Oh. All right, Rose, I feel like I might have picked the right person to ask this question now.
Okay, Jason, this might be a difficult question for a surgeon, but can you reflect on what might be some of your weaknesses?
Oh, okay. So I've actually thought about this question a lot now, as it's one of the things that I think about most often is where I'm weak at. So there's three, I'd point out two. I don't like to point out all my weaknesses, but these are 2 or 3 things that I find that I can improve on and I'm striving to improve on. The first thing is I tend to stretch myself too much, and I'm very much a yes man. So what that means is I've had consultants in the past ask me to do research projects with them countlessly, and I could never say no to them. So a recent scenario was when I was covering at the Princess Alexandra Hospital as an unaccredited registrar in MaxFax. While working and studying full time, he asked me if I can do a research project with him. At the same time, another consultant has asked me to do a research project with him. And to not get in their bad graces, I said yes to both. And that has, in the past, burnt me and has stretched me quite far. Another situation, another weakness of mine is dwelling on past mistakes. I know that in the past that I've made mistakes, even in tight situations like in operation theater and whatnot. Instead of moving on to the next patient that you're caring for, you dwell on past situations, whether you took out the whole tooth or whether you prescribed the right antibiotics in that case. And a third situation where I think I have a bit of weaknesses is I tend to be quite quiet and not be very vocal about things I feel strongly about in terms of a leadership role, and I tend to follow what is suggested a lot of the times. This was in the case of certain times when the best management is to not do anything. Some of my registrars had suggested to Sorry, I just need a second. Sorry, thinking back at that situation, I was mentioning how my registrar would opt for a specific treatment, as in actually take out a whole tooth and removal of a wisdom teeth, when maybe the best option is just to do a coronectomy, which is just to take off the top of the tooth, which reduces the morbidity of a specific situation. Now, with all these scenarios, I'm trying to work on every day, as in, assessing for feedback about my progress in these situations. So in summary, a few of my weaknesses, I would say, would be my overstretching myself by not being able to say no. The second is my leadership, my quietness, and not prompt to more innate to follow. And thirdly is sorry, I forgot my third one. Sorry, I kind of choked there a little bit.
That's all right. Why do you reckon you choked?
Because maybe I was thinking about it too much, or maybe because I was thinking about a certain example and I was not actually thinking about
I can see you trying to use examples, which is really good.
Yeah.
I can see you doing that.
Sorry, I was just going to say it's a really difficult question for anyone to try and answer. But they always throw this one at you, I think. They throw it at everyone.
The more that I was thinking about it and the more I was thinking into it, I was like, oh, I should have maybe said that one. And I'm like, oh, I'll think about that one. And then now it's just kind of jumbled it a little bit.
Don't worry, Jason, this is a very safe space. There was lots of great content in there. And it's a really tough question. And I am really glad Rose asked it and that you answered it the way you did, because it's so rich for learning. There's lots of good stuff in there. Trying to use an example is excellent. What do people think is it? Like, anyone got a different approach, like how Jason might have answered it better? This is a really tough question. It's commonly asked, as Rose said, so we all need to have a really great answer ready, which is why I'm glad, Rose, that you've pulled it out for me. So I think when you're talking about weaknesses, you need to try and pick one, maybe two, but I reckon one. And you're not going to pick a weakness like I'm a perfectionist. That's like wanky. I know none of you will do that because that's not actually a weakness. Well, generally, you want to pick something that is a weakness, but you want to pick something that you have already made an action plan on for you to improve, and that you've already started to improve and you're still on the improve. So I had an interview a little while ago, and it was for a director position, and I haven't done a director position before. So my weakness was that I haven't had a formal leadership role before. It allowed me to then talk about my experience in leadership, and I could talk numbers. So although I haven't had a formal director position before, the position I'm currently in has me responsible for the education and training, rostering and wellbeing of 180 doctors in the emergency department at Gold Coast Health. I recognise, however, that I haven't got formal training in leadership. So what I have done is I've enrolled in the Queensland University of Technology Leaders in Healthcare course, whatever it was actually called, which is due to start on the 1st of August. I also know, I've also made contact on applying for this position with 3 mentors who are in Director of Pharmacy positions. For example, one who is so-and-so, who I have really close personal and professional relationship with, who's actually one of my referees, who's agreed to meet with me fortnightly should I get the position to start with, to give me support on leadership things that I might need some mentor support from. Something like that. I realise I just kind of jumped from talking to role-playing a little bit, but I think you've got to pick something that is hand on your heart honest, something that you think they might have picked out of your resume already if they'd gone to the trouble of looking at it, but something that you've got a clear plan that you recognise and are working towards. So I want everyone to write in the text box, what would you think? What's your weakness? And just even write a couple of words as to what your weakness is. I'm trying to make you have something in your toolkit here. Sarah, yeah, go for it.
Could you say, I mean, kind of flip it around and say, well, I think one of my, so for me, as an example, I think one of my strengths would be my experience in internal medicine, but I have a relative inexperience in histopathology and procedural dermatology. So that would be a possible weakness for me on entering the training program. Things that I've been doing to minimize that being an issue is weekly histopathology tutorials with my consultant, and also regular procedural experience in the biopsy room and in minor ops with superficial skin excisions and lasers on a fortnightly basis.
Yep, that is great. I would then talk about how many of these specific procedures you've done since then, or how something specific you've learned from one of those histopathology tutorials that you were talking about. Pull something really specific out of that, which really makes them think, oh, she is doing this and she's taking it seriously. I think you're right. You've got to be careful saying, like when they say, tell me about a weakness, you do have to be careful saying, well, one of my strengths is, because then they're already thinking, we asked you for a weakness. But I think the way that was just your motherhood to then frame, but one of my weaknesses, which I've recognized from that and from my other experience, is this. So I think that was a good way to do it. But yes, a really clear plan. You can even say, my plan is 3-part. The first part is, you really want to show that you're on the up. And I think, Jason, what you did is you answered the question too well. You really laid out 3 weaknesses. What you want to do is, I reckon, pick one of them, but pick something that you're working on, so that it almost feels like something that you've got really great self-reflection and feedback on and what you're doing about it. So let me look at what other people have put. I wanted to know a bit more, Flick, about what happened after and how you've reflected. And now when someone asks you to do extra research, what do you say? I totally agree. So Flick was left wondering that about your examples, Jason.
I don't know what to say. I still continue to say yes. So I haven't really learned from it.
Don't talk. I reckon that's not your weakness then. That's not it. You need to pick something that you've worked on.
Okay.
I was hoping that the story was you reflected quite quickly. You went back to one of them and said that you couldn't do it, and that. So I've worked with this great guy this week, and he said that he took on too much. And then he talked about, he had was doing all these things. He named the 5 things that were on his plate. And he said the one thing that had to go was my teaching at Griffith University. And I have loved doing that. I have been doing that for X years. But 3 years ago, or 2 years ago, whenever, I gave that up because I knew that I needed to, simplify what was on my plate. I really look forward to doing that again down the track. But he was really clear about what he'd weighed up and what he gave up. Mariko, sometimes it forces you to say the things you'd never usually want to say in an interview. I totally agree. They're getting you to do their dirty work for them and pick out something that's, but I think it's actually try and reframe it in your mind to think it's an opportunity to pick out something they may have already picked out about you already. Like, I knew these people were she doesn't have director of pharmacy experience. I knew they were thinking that. So it gave me an opportunity to say, I tried not to give them something new that they might not have otherwise known about me. I am crazy. If you hire me, you are going to see how crazy I am. You don't want to pick up something that they don't know about you, but I think it's about picking something that, or that's the things that you described, Jason, are all things that probably all of us can relate to. None of them were awful weaknesses, but I think it's about having a plan. Somebody else told me a great weakness where they didn't speak up in a resus type situation. The patient was still okay, but perhaps they felt that whatever needed to happen next was a little bit delayed. That was a year ago. They got some advice, spoke to a mentor, did a simulation, and then what they've done is they've been in a similar situation 3 times since then, and they've actually got feedback on one of those that they did speak up. So maybe something like that. Flick, no experience with neonatal resus caring for premature babies, but then you can reflect on where that might come into your training. I think that's a normal thing. Maybe you could talk like Sarah did a little bit about trying to get some exposure to that type of stuff, or through educational means rather than in practice. You could talk about how you've tried to access it that way so that you're ready for that when it comes, but that you'd really look forward to that rotation or that part of the training program. Rose, ruminating over mistakes or potential adverse outcomes. The other great thing I've heard about from that point of view is, and Rose and Jason, I know you bought into that as well, and Ash, I can just see you there, so I want to make sure, is that you now have a book where you go home and you write down a reflection on what's happened and what could have been done differently or what you did well, and then that, like, writing it down or debriefing with a mentor even allows you to get some closure on those cases and try and leave them at work. Maybe that's something that you could say that you've already incorporated in your practice so that you're on the improve. Cool. That's been so helpful, everyone asking their most feared questions, most random questions. So thank you so much for bringing those up. Is there anything else anyone wants to touch on quickly before we move on? Any other scary questions that people feel like we haven't yet worked out how to answer? I think the types of questions we're getting to now are the like 1% type questions, which is really good. All right.
Just with answering the journal article question, how would you sort of go about that? Do you just say, oh, this is the journal I sort of read and these are my learning points? Or do you
how many learning points might you pick?
1 or 2? 1? 3?
2 or 3, I reckon. 2 or 3.
Okay.
Weaknesses, you pick 1. Everything else, you pick 2 or 3. And I think, you know, they often say, what's the most recent journal article you read? So it doesn't have to be recent. It just has to be memorable. I think before an interview, you should all think about a journal article. But I think perhaps pick one that plays to your strengths. So, for example, you might have just done some teaching, Linda, on rheumatology as part of your rotation. You might have picked up, you taught the interns about rheumatology. Telling them that allows them to see that you've done some recent teaching on rheumatology, which is a feather in your cap already. But then you can say, I was really interested in this particular part of rheumatology. So as part of preparing for that lecture that I did last month, I read a journal article on insert drug use in rheumatology here. The pharmacist in me has gone a long time ago. So, try and think about something that can link in what you've done. Like Sarah shared her, was it histopathology? You might talk about something that you looked up that was about those particular lesion removals. Try and think about something that shows off some of your knowledge and some of your research in that area. So I do suggest as homework, and I think I've got this in the study plan, that you do find a journal article, because it's a semi-regular random question that they'll ask you, along with weaknesses. That's, I think that's probably one that you should be ready and expected for.
Can you choose this might be a little bit arrogant, but can you choose a journal article that is your own, that you've recently read, because you're always familiar with your own stuff, and then link it to something that you're going to do into the future, as in a future project? So like kind of trying to double dip or triple dip, if you would.
I reckon that's a little too far, but I think you could talk about a journal article you read which you referenced in that article that you published. That's how I'd go about that, Jason. So a little bit less cheeky. Okay. But I think it's good to point out, like I've just completed my PhD. One of my favorite articles, which I keep going back to as part of that work looking at pharmacists working on ward rounds, was this one by Fertelman et al. And this is 2 or 3 main learning points out of that article, or this is how that article, allowed me to reflect or change in practice. So linking it back to yourself. Good question though. I might give you like an extra Freddo frog or something if you manage to get that in without them smirking at you that it was your own article. Cool. So what I want everyone to do now is just take a breath. We are nearing the end of our final, session of our 3 sessions. So I really want you to think right back to what we've covered. We've covered really 5 types of questions. The first is motivating questions. So like, tell us about yourself. Remember, we used CAMP. The second is, we talked about like the 2 or 3 things. So if they ask you kind of factual or information type questions, you should always talk about 2 or 3 key things. The third question we talked about was behavioural questions. Tell me about a time when. The fourth was like these SPIES questions, which are situational questions. They say, this is a situation, how are you going to deal with it? And the fifth was these random questions, the other questions, which might be weaknesses or last journal article or artificial intelligence or spirit animal. So think back to all of that work. It's like 6 hours of face-to-face stuff, lots of pre-reading, homework, etc. I really want you to just talk about 3 specific things that you plan to do in your next interview as a result of this. But be specific. Don't just say Camp Star and SPIES. No one's allowed to say that. So let's take 1 minute. That's called a 1 minute reflection. There is a great journal article on 1 minute reflections that you might want to look up. Everyone's thinking so hard. Thank you. The reason this is great is, as Sarah so eloquently outlined earlier, because you all get to learn from each other, and something that really stuck for you might not have stuck for somebody else, but it might once I summarize and send these around tomorrow. So I so appreciate you guys popping these in. I think have fun's such a good one, because I think it's like showing them who you are, you know. Thank you, everyone. Keep typing away and I'll keep grabbing those. Before we go, I just want to talk for 5 minutes about on the day. Let's bring us back to where we started with our pre-reading, right? So thinking about how you might come across in an activity. Just try and remember that when you ask your colleagues and friends before you started these series, how you might come across. Some of us said serious, some said waffly, some said thoughtful. Actually, lots of your friends and colleagues gave you compliments, you guys, from my memory. But I think it is about thinking about how you might come across and just trying to be aware of that. You do want to come across as who you are and be really authentic, but I think it's about maybe just making sure that you're in check with how you might sound. If you sound quite serious or robotic because you are really nervous, it's about thinking about making sure that you are smiling and using phrases like fortunately or I was really lucky, like showing that passion through some of your phrases. Remember the power pose? I'm sure most of you would have watched that by now, but that's that beautiful talk, TED Talk. And she just talks about making sure that before the interview, you really open your body language up. If you can go to the bathroom or a quiet room, you know, you can stand like Superwoman or Superman, but even just not crouching down and closing in your body language. I had a friend who actually sent me that TED Talk a couple of years ago because she knew I did a lot of this, and she said she did it. She did it for her final like Viva practice exam, you know, oral exam in emergency. And she literally got the feedback that there was something about you when you walked into the room. How crazy is that? You know, and I mean, the lady whose name has escaped me talks about that. There's evidence behind this power pose stuff. So just make sure you're not shutting yourself down. You're stretching out, even if you just literally do a stretch in the waiting room or wherever you are, just to try and get into the zone. Definitely avoid anyone who's waiting for an interview whose anxiety or energy you're going to be feeding off. Just get a quiet place. Even just say, sorry, I need to go pee. Get abort. If you're able to feed off, because those last couple of minutes before you go in are really important. So be selfish about it, I think. Arriving early is important. I always say to arrive early or do a practice run the day before. Get someone to drop you off or get a cab so that you're not having to worry about parking, etc. But when you arrive early, then avoid everyone who's there. So I always think you can see the building, you're around the corner, you know where the entrance is, you know that you're 1 minute away, but don't go in 15 minutes early or half an hour early. Don't loiter. Just arrive early so that you're not going to be late, but then don't go and see those other people who are there if there are other people there. Zoom removes all of that, doesn't it? But certainly for Zoom, you need to be ready, dressed, not in your pajama pants, even if they can't see that. All of that ready and have time to do what you would normally do before an interview. Just have some time on your own. Don't be running in 10 minutes before it's due to start. Take what they ask you to take. So often they will say, you're not allowed to have anything on you. For some interviews, you're allowed to take like a portfolio or some examples of your work. The portfolio thing seems to be more for local positions, like, for example, fellowships or consultants that are at a particular place. It would be handy if you have a portfolio. For a lot of these more formal, like specialty training interviews, I think it's just wise to take what they have asked you to take, which in most cases is nothing. Eat and drink well. I know that sounds easy, but a lot of people, won't eat and then they'll be feeling so nauseous because they haven't eaten anything or vice versa. Make sure you pee, all of those types of things. And I know we talked at the start about Zoom, but a couple of quick tips is make sure that your computer is raised up at head height. It's not looking up or down at you. And I know all of you it's a Thursday night and it's nearly 9 o'clock and you're comfortable at home, but you really want to get a couple of those old textbooks you haven't looked at for years and raise your computer. I also suggest pushing your computer away unless you need to touch your computer, which you shouldn't in an interview. It's really good to push it far away enough that they can see your hands in resting position or at least the top of your hands. They also want to have a clearance over your head, which I know I don't have right now, so I need to be further away. But you want to see the top of your head, not it cut off. The reason it's good to see your hands in resting position is because they're not then flying in from out of screen. So you can't see my hands now, and if I'm talking and then all of a sudden this hand is like coming up, out of nowhere, it can be quite distracting. Whereas if they can see even just the top of your hands, the idea is they can see down to your elbows. If they can see your hands in resting position, which now means I'm cutting off my head, but if I had that angle right, at least then the resting position, when you're coming up and talking about things with your hands, which you should do, it allows them not to be jumping in and out of screen. It's much less distracting if they can be seen in resting position. It's really good to get online with somebody else and try. Even get online with yourself out in the corridor if you need to, with another person in your house on the device, and just have a look at what it looks like. If in the background it's dark and not right, I actually use this space, and I think I said that to start with. I'm in like a co-working space at the moment. This is not actually my home artwork, but it's worth. So somebody I have been working with hired this space yesterday for an interview. It was reliable internet, and he said he was in a different room which has something similar on the wall. And as soon as he logged on, they said, "Wow, we like your artwork. Where are you?" It really makes that impact. The lights are great, and the people that work here will help you with that. Like this lady that runs this place, she was like helping him adjust the windows. He came in a couple of days before to try it. But if you don't have the right space at home for a Zoom interview, then hire a space. It's really money well spent, and it's not expensive, to be honest. So I think it's just about making sure that you've got distractions away in a really great, clear place with good lighting. Any questions about that before I move on? Great. So as far as the study plan, which I've promised you from the start, I'm going to send that through tomorrow with the summary. And I think the study plan will help you. The start of the workbook is just about what we've covered, with lots of things that we've covered in there as a reference for you. And I'll also send you a copy of the slides for a reference as well. But otherwise, it has a study plan with things to look at. For example, it has SPIES, and then it has some questions that you can practice. It has STAR and some questions that you can practice. It also has things in there like what I think you could try and look up on the college website, thinking about the core competencies. It has things like graded assertiveness, which we've talked about, those types of phrases that are really nice things to bring in an interview. So it's all really spelt out there. If you have any questions about that study plan, of course, send me an email. I'm happy to answer any of them, but I feel like it will allow you to keep on track, regardless of if your interview is next week or next month or down the track. Also, if you have an interview in 5 years' time, you can pull this out and remember everything that you've been talking about over the last couple of weeks. It's funny, somebody who I worked with years ago for a fellowship job wrote to me recently and said that she had pulled out her booklet and used it with her son and daughter-in-law who were like in totally non-medical fields, and said that they just thought it was amazing and really useful and they could apply all of this in their areas as well. One was stock marketing and the other was like engineering, I think. They were like in, new grad positions, but it's super helpful. Of course, I ask you not to just pass it on willy-nilly, because this is, specially designed for people that I'm working with, and lots of hard work has gone into it, of course. So as far as practicing, it's really common to practice the wrong thing. So make sure you're really careful who you study with. Study with people who are going to give you good quality feedback and who are familiar with what a good answer looks like. There's often people will study with like well-intentioned partners who don't work in medicine and have never sat this type of interview. So just make sure that I think you're all definitely intelligent enough to gauge whether somebody's feedback is helpful or not. Just practice with people who make you feel good but give you really great constructive criticism. The other thing is, don't give away all your secrets, tips and hard work. So I do hear about these group training sessions prior to a big interview, which I know are really well-intentioned, but just make sure that you're not the one at the table that's offering all the tips and doing a beautiful job of frameworks for other people to hear and copy. You want to just hide your cards a little bit. I know it's hard when you're often working with colleagues who are friends, but I would just hate for all your hard work to be like sponged off in a group setting. So just be a little bit cautious. Maybe you can start doing a really bad job of things and then they might try and copy that. Consider this an exam. It's a huge part of your lives, and I know you've all got these stressful days coming up. Hey, Ash, do you know Mariko? Were you here when we heard about Mariko's news?
No, I wasn't. I'd love to hear it, though.
I'm going to tell you for the third time. Go on.
I had my interview on Monday, and I found out yesterday that I got into the psychiatry training program and got my first preference.
Oh, that's awesome. I'm so excited for you.
Thank you.
Oh, that's a quick turnaround.
So
they said in the interview to be 1-2 weeks, and then I got a call 2 days later, so it was very unexpected.
You were that good.
And did the interview feel good? Like, did you feel comfortable and confident in it?
No, I get really bad nerves. So the couple of minutes leading up to it, I was honestly trying not to faint. But I got in there and after it all happened so fast. And afterwards, of course, I picked myself to pieces and picked on every negative thing. But actually, quite a number of the questions were things that I had prepared and that I used the framework for. I just didn't do it as neatly as I would have liked, but actually I think that the key points were made. So if you'd asked me that before I'd found out, I was still in the phase of beating myself up. But now that I've reframed that a little bit, I'm.
Well, it worked, obviously. It doesn't matter how well you did it. And I'm pleased that you came for the third session. I would have just been like, I'm out of here, guys. I got onto the program. See ya.
I have a plan of using these resources in a few years' time when I go for something else. So
awesome.
File them together and save them somewhere handy. I'm
stoked for you. Well, the YouTube, I made sure that the links that we save, the recordings get saved onto Live Webinar, but Live Webinar has not a very large storage. So that's why I download them onto YouTube. But the YouTube is a closed channel. So the links that I send you guys are all unlisted. So you have to use that link. So it's not like you could Google a public YouTube page, bullet interview prep in a couple of years' time and find it. It's only that link. So make sure that you save it somewhere if you want to use it in a few years' time again. But if you do lose the link, just email me. You won't easily find it. So just email me on my info@medicalcareerplanning.com.au and I'll just send you the link again.
Yeah, we're so excited. I feel like I started on such a high. So we've covered all of the frameworks I think you need. I have just tried to put a little SurveyMonkey link in the text box, but I don't think that that's worked. Can anyone see it? If you can, so what I've done is just put together a quick SurveyMonkey, which is about the course. I think there's only like 7 questions. I think it should take you 2 minutes. If you can see it there, can anyone see it? Like not on the screen because that won't be clickable, but in the chat box.
It's uploaded as a PNG image rather than...
Oh, that's a pity.
Just email it to everyone, Brookie.
Yeah.
It's always just, I always get a much higher uptake when doing it right now, but that's fine. I can definitely email it to you. But if you wouldn't mind just spending a couple of minutes in the next couple of days, I'd so appreciate it because I think, you know, this is a big output for you guys as far as your time and energy and money. So I'd love the feedback so we can make sure that this is hitting the mark for people who are applying for the jobs after you guys have all got them. Don't worry. It's always a funny field to work in because referrals often come 1 whole year later, not any sooner, because I know it's really important that we're not helping our competition. So on that note, you can also follow my Facebook page, which is Brooke Bullock Interview Coaching, and also, of course, Medical Career Planning, which through Ash, and it's just been such a pleasure to work with Ash on this. And I know Ash has lots of other awesome things coming up. So I think that you'll all be added to the Medical Career Planning email group. If you prefer not to be added to that, that's totally fine. Just pop Ash or myself an email and we'll make sure that you're not added. But otherwise, you'll be added just with those regular updates of what Medical Career Planning has to offer, all of which I'm sure will be helpful at some point down in the future. So it's always good, I find, to be in those types of groups. Ash, did you want to add anything specific about anything coming up?
No, I've got some workshops coming up, but I think you guys will be all fine because they're all career planning workshops and trying to figure out what you want to do if you don't know what to do. But we really appreciate you guys coming and being part of this. It's been really good fun, Brooke and I working together because we both obviously work in similar areas, but not similar. So it's been really fun to collaborate and have a team of people who've been so enthusiastic, and we've absolutely loved doing these together. So thank you all our participants, and we just want you to get all your jobs. Can't wait to hear. And we want to hear how you go.
We want to hear for sure. I'd love to hear from you about, what, and even if you feel like a debrief. And I think the last thing is, I do, and as I've mentioned, I do one-on-one sessions through Medical Career Planning, but Ash and I decided that for the group who've gone through this workshop, we're happy to offer a big discount. So if anyone wants a one-on-one session where there's 2 options, it could just be like kind of practicing questions with feedback on each, or the other option is having like an actual mock interview prepared for you. So what I try and do is mirror the types of interviews that you guys are going for, depending on your specialty and area, and have that all ready for you. You then get like slammed with the questions, have to practice that cognitive load of changing between questions and frameworks, and also recovering if you're not sure how well you've done onto the next question quite quickly, and then a big chunk of feedback at the end, of course. So if you are interested in any of that, I have some availability in the next couple of weeks for people who have got things really soon. But of course, this offer for you guys stays true afterwards. So just send me an email directly. You've all got my email, and we can book something in. But on that note, a huge thank you from me. It's tricky. Webinars are tricky. So what it really relies on is like a really interactive, engaged group who are resilient enough to try different microphones when things don't go right at your ends too. So thanks so much. And I just can't wait to hear how everyone goes and hope to connect with you again in future. So thank you. And thanks, Ash, for having me.
I'll just add as well that I'll send everyone their receipts for payment for this in case they want to claim it on tax. I think just double check with your accountant. People always reach out and say, can I claim this and that in tax? And I'm like, look, I will never give you tax advice. So I'll send you your receipts, but check with your accountant if you can claim it. Awesome.
All right. Thank you, everyone.
Awesome. Thank you.
Good luck, everyone.
Thank you.
Marco, just go enjoy the champagne already, hey? Bye. Oh, you deliberately have poor lighting, Ashley. I just saw that.
Yeah, I thought I'd make sure the lights look bad just so you can see the
I should have
dull
made
it
a
looks.
comparison.
Yeah. How'd it go?
Yeah, good. They're so good.
They're a really good bunch, aren't they?
I'll set that up. Hang on. Oh, did you stop the recording?
No.
Oh, where is it? Oh, stop recording. Great. I'll just stop that now.
I've stopped it.